Located on 225 acres in Garden City, Long Island, Nassau Community College, a member of the State University of New York system, has close to 20,000 students attend the school each year. The college mascot is Leo the Lion, and these are his stories of the school's absolute best and brightest who have graduated over the past 50 plus years. So let's catch up together as the Alumni Association of Nassau Community College proudly presents Lion Tales on the voice of Nassau Community College, 90.3 WHPC.
Welcome to Lion Tales. My name is Dr. Lynnda Nadien, and I am a director on the board of the Alumni Association at Nassau Community College and a proud graduate. I am here to celebrate the successes of our alum, and together we will share stories that will uplift, inspire, and often amuse you. Each week I will introduce you to the alumni of Nassau Community College interested in sharing their experiences while attending the college and the secrets to their success. Look for many new and exciting events on the Alumni Association social media pages and share any exciting news with us on Facebook, Instagram, or on our webpage at ncc.edu/alumni. Or find me on Twitter at Dr. Lynnda Nadien. Did you know Leo the Lion is the mascot for Nassau Community College? Lions are ruled by Leo and fire. The male lions represent pride, while the female stands for teamwork. Together, we are Lion Tales. Today, I would like to welcome to Lion Tales Dr. Robert Peck, class of 2008. Dr. Robert Peck is a foot and ankle specialist who graduated from McGill University in 2005 and attended Nassau Community College Phi Theta Kappa graduate in 2008 with a 4.0. Dr. Peck earned his Doctorate of Podiatric Medicine in 2014 and completed his residency in podiatric foot and ankle surgery at Metropolitan Hospital in New York City in 2017. Dr. Peck's hobbies include ping pong, chess, and nature. He has a degree in classical music performance, and he is seeking to expand his practice and become more involved with Nassau Community College. Welcome to Lion Tales, Dr. Robert Peck, class of 2008.
Well, thank you.
Let's talk a little bit about your first experiences at Nassau Community College coming from McGill University.
Well, when I first came to Nassau Community College, it was originally to take only a few courses required prior for me applying to any kind of medical school or anything afterwards. However, I enjoyed it so much that I decided to stay on for the year and earn my associate's degree in physics.
So tell us a little bit about that once you came to campus. Now, usually when students graduate from high school and they know that they may want to have a career in medicine, what were you thinking about at that point? Were you sure that you wanted to pursue medicine prior to McGill?
No, I wasn't really sure. It's just that after I took a lot more of the courses at Nassau Community, I felt that a lot of the courses prepared me to go into my specialty.
Okay, that's great. And so when you did get to Nassau, what were some of the courses that really sort of made you realize that you wanted to pursue this degree?
Well, definitely the anatomy and physiology course. My professor for the course was my lab professor was Emmanuel Pepitone. He made the course so fun. It was just so exciting with him. Just he had this different way of teaching it that we would remember every part of the body it made it really interesting. It was a really interesting course.
Yeah, I think that when I had a lot of science classes here as well, like the bio, and a big part of it was the lab. And I remembered I did so much better with the lab because it was so hands-on as opposed to just taking a regular multiple choice test. And so in those anatomy and physiology, physics, was it physiology or physics?
No, I took both anatomy and physiology and physics at Nassau.
Okay, so what do you think is the best way for a student to learn the terminology and work on that? Because that's a big part of the program that you have to go through.
Well, it's not only doing things by rote, by remembering things, what attaches to where and what nerves are what, but you also need the hands-on experience where they showed us certain type of parts. They used mannequins or models, anatomical models to demonstrate it. To take this piece fits in here, this nerve goes to here. So it was a little bit different. It was a little bit different than just reading the textbook.
Right. How do you learn to become sort of an intricate surgeon? Were you good with your hands doing that and thinking it, while your brain is working and your hands are working at the same time?
Well, the courses at Nassau helped me prepare for the courses in medical school also, because I had to again take anatomy course from the head to the toes. But now on a real dissection, dissecting humans, not just dissecting plastic. I also had to take physiology and all the other courses, some other courses like microbiology that I took at Nassau as well. So actually, all the education I garnered at Nassau helped me in my medical career.
Yeah. Now, do you like performing surgery?
Oh, I love surgery.
Yeah. I know a lot of doctors that I know tell me that that's one of their favorite parts of their job, not just, assessing and diagnosing patients, but also actually performing the surgeries. What types of surgeries have you, performed that have been successful?
Well, all of my surgeries have been successful, to my knowledge.
Yeah.
However, I really enjoy my specialty right now. I focus in on wound care. Those patients who are diabetic or those who are elderly or even those who have injuries that need special attention and need either a complex reconstruction of their foot or even just basic reconstruction of a diabetic ulceration.
Wow. We know that feet are an extremely important part of the body that take a lot of abuse, pretty much. What are some ways that, people can take better care of their feet and make sure that they avoid certain injuries, especially when you're playing sports or just having a lot of walking throughout the day?
Well, first of all, you need to wear proper shoe gear. And that starts off with not wearing like flip-flops while doing basketball.
Right.
We also have to pay attention to our bodies. My patients who are over 40 should not be playing like a warrior like they were on at 22.
Right.
And a lot of stretching, following advice of coaches, and just treating your feet. Don't over and abuse your feet.
Yeah, that's true, because they are a very delicate part of the body, and even a little cut can be difficult to treat. And so you were speaking too about the fact that you do a lot of home care now. Can you talk a little bit about that, going into the home?
Well, during my practice at Long Island Foot Centers, that's my own. I started this practice up. I founded it from the ground up, and during the pandemic, there was a need for house calls, especially for elderly, disabled, anybody who couldn't get out. And that has blossomed into a really big practice where I travel to patients, treat them, and for those who really can't get out of the house or who are scared to still get out of the house.
That's a great thing, too, because this was my thought from before. I know I was talking about a physical therapist, and one of the doctors that treats a patient in that practice was saying that they did do house calls during the pandemic and also for the elderly, which I thought was a great idea because it does make sure that people will seek the medical help. Where, sometimes if they don't come in, it could turn into something more dangerous for them. So I think that that's really an amazing thing to be open to, as a doctor and traveling into people's homes and treating them like that. What were some of the obstacles to become a medical doctor? First
of all, you have to have a good GPA. You should have a good GPA. And that starts with studying a lot. You need to do a lot of studying. If you're ever thinking of going into any medical profession, such as a nurse, a doctor, any different profession, you will need to study all the time. And taking away from your other, a lot of times it's hard for you to do other things such as go out with friends or go to the movies. I mean, you're going to be doing a lot of studying and a lot of work. A social recluse sometimes.
Yeah, absolutely, because I know it's a lot to do. How did you balance it out? Usually people who are getting their doctorate, for example, they say how to do a doctorate in 15 minutes per day because basically you're always focusing on having that work right there so you can get it done. What was that like for you? How much time did you devote to that study?
Oh, I would study a few hours per day.
Yeah.
Besides going to my classes, but that's for anything. I mean, if you want to be successful in anything.
Right. And did you have a good memory for terminology and application?
Well, depends. I mean, yes, I had a memory for the test, but then I forgot everything.
Right. Yeah. That's what usually happens. Like you'll be completely well versed, and then the next day you're saying, I didn't remember what that was. You were listening to Lion Tales on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Lynnda Nadien, and our guest today is Dr. Robert Peck, class of 2008. So you also have a variety of interests. How did your interest in music and studying coincide with your medical work?
Well, actually, my first career was as a classical musician. I'm a professional cellist, and I studied that in college.
Yeah.
And I mean, it didn't really I did take some courses in undergrad, but mostly a lot of my courses that were required for going into medicine were taken at Nassau Community.
Yeah.
And I really, really enjoyed that. Music is still a big part of my life. I still go to, concerts and shows, but, my work comes first.
Yeah. Now, it's sort of a coincidence, too, because a lot of medical doctors that I know are musicians as well. And, again, when you think about the brain and how the brain functions and different talents that we have, it's something that is interesting that people that are in the medical field are also, trained as musicians or they're classical. What was some of your interest when you were younger? How did you decide to study the cello?
Well, when I went through the public school system as everybody did. And the cello, I actually wanted to study the double bass, but it didn't fit in the car. So I decided, okay, well, I'll settle on the cello. And I'm really glad that I did because it was a great instrument for me to do. And pursue. I mean, I went through the school music program to all county and other things, and then doing a lot of different things.
So coming onto the grounds now today at Nassau Community College, what was it like to be back here and sort of reminiscing about all of the courses that you did take and the work that you did here? Because you actually have your associates in science from Nassau Community College.
Yes, I do. I mean, when I first got onto the campus, I haven't been on the campus since 2008.
Yeah. Which
is surprising because, I said, oh, wow, this is so familiar. Except now they're building a cooking school, which I might actually decide to take some courses there. That kind of interests me. Getting back on the campus, I always enjoyed going to classes and the buildings were very, the class size was very small. The buildings were very nice. It was a big reprieve in going, in contrast to both before when I was at McGill University, where we'd have a class size of 300 and very impersonal, whereas Nassau you have a class size of 30 and very personal. And then going to medical school where you again have a class size of like 100 or 150, very impersonal. So it was more of a nurturing environment here.
Yeah. How did they nurture you as a medical student when you actually were in medical school? Coming from a community college atmosphere where it's sort of very hands-on, did you find that there was support?
Yeah, there is support, but you have to look for it, and there's not as much support in the medical field or as you would have in the community college. This is more going to Nassau for most people is more of a transition from going to high school off to community college, and then they will prepare you to go on to university. Yeah, which a lot of times is beneficial for a lot of people.
Yeah. Did you find that what were you seeking sort of in, I guess when you're in medical school, there's competition as well. Did you find that you were well trained to complete those courses and complete what was expected of you?
Well, the training is, if you know how to study, then you're well trained.
Yeah.
But it really depends on numerous factors.
Yeah.
Because you got to study day and night sometimes. You got to do all-nighters. And it's just, but you have to still continue to get your sleep, because if you don't get your sleep, then your mind doesn't work.
Right. Yeah. So now, do you find that when coming out of, I guess you have your own practice now, and you're seeing many different patients, all different age levels. What is the age level that you enjoy working with the most?
Oh, I see everybody from age 1 to over 100.
Wow.
And my favorite age range is usually in the over 65 category, because they usually have the most problems.
Yeah.
They tend to have need the most care as well. I find that it's very rewarding to work on people that could be my grandmother or could be my mother.
Yeah.
And it gives me joy.
Yeah. What are some ways to prevent foot and or ankle injuries or long-term issues? Are there any ways to do that? Assuming that you don't have diabetes and that you don't have any underlying conditions, is there a way to kind of treat your feet well?
Well, as I said before, you need to wear proper shoe gear. I won't name specific shoe gear because there's no. This is not an infomercial.
Yeah.
But something that's supportive and not believe just because somebody wears it, it's supportive. Also, if your body says something to you, if it says I'm hurting after a workout or after exercise, please take heed, because you could do a lot more damage if you just ignore it.
Yeah. Whenever people are traveling too, and you haven't done a lot of walking, and then suddenly you're doing a lot of walking and everyone's tracking their steps, how did that really become, such an important thing about people's steps and the number of steps and all of that? Do you think that was really from, what sort of community did that come out of? Not really from a TikTok video, but somehow, we're all obsessed with now this completing a certain number of steps per day. Is that really a legitimate thing?
Well, in my knowledge, I think that having the 10,000 steps, which I never do per day, maybe I've done it once in my life, it's more of a medical and health benefits. I mean, if you're not able to complete it, don't complete it, because, we don't want you to push yourself so that you'll need other medical care. Right,
that's true. Because I see that, you can't force yourself, because you really want to be active as much as possible. So right now, coming back to some of the professors that you had at Nassau, you were speaking about your psychology professor. You want to tell her a little bit about her?
Yes. My psychology professor for 2 of my courses was the late Dr. Mary O'Loughlin, and I had her for 2 semesters. During this time, I gained a lot of insight that I would put to later use in my residency, working in the psychiatric wards of the hospital and dealing with the psychological aspects of my patients, not just the physical.
Yeah. That's amazing that, some of the professors are really a big inspiration to the students. And, you always remember that, level of comfort and support that they provided to you. And so when you were here on campus, you were also part of honor societies, and you were president of the...
I think I was president of the Honors Society or Honors Club for a little while at least, or I was co-president after being voted in. So that was nice.
And what was some of the duties that you did on campus for that? Do you remember?
I don't recollect, but I know we had to do some functions, and we had to just organize some different activities that were going on.
And now when you do go in, from coming out of a community college with a degree and then going into a medical school where there's a lot of, other people, it's much larger, obviously. Did you bring any of that expertise with you there? Did you feel that you could sort of be a leader in that capacity as well?
Yes, I actually was during my during my education in medical school. I was a vice president of one of my clubs. It was actually a forensics podiatry, which is a little bit interesting, dealing with like what you see on CSI and but it's and like Law and Order or whatever. But yes, it did help me being president here at Nassau. Well, president of a society here at Nassau, and then help me with leadership in the club in medical school.
You were listening to Lion Tales on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Lynnda Nadien, and our guest today is Dr. Robert Peck, class of 2008. So now, being back on the campus today, what are some of your feelings being back here? And how do you think, if you think about your journey from 2008 until now, what is that like for you to be here?
Oh, wow. I mean, this takes me back. It takes me back into 2007, 2008 when I came here. And it was life was such an easy time back then. It was much, I remember not having to worry about things and, everything was laid back. But now, after 10, 12 years, I feel like I've been there, gone through everything and came back.
Yeah. How long have you been in practice now?
Oh, I graduated in 2017 from residency, so I've been in practice about 6 years now.
Yeah. And now, what are your ultimate goals now? Because 6 years is a while, but it's not a full decade. But again, it's getting to the point where now you can make some other decisions about, how you might want to see your practice. So what are some of those goals that may come up at this point?
Well, my goals for my practice are, of course, to expand. Right now, I'm in negotiations to add my first associate onto my practice, which was very nice. And I'm looking to take my practice and possibly get more involved in the Nassau community, in Nassau Community College, in the overall community of Nassau Community College, and to do more things at Nassau because this is my alma mater.
Yeah.
And I mean, I don't have any alma maters that are close. I mean, I live 5 minutes away or 10 minutes away, so it's not.
Yeah, and it's really amazing because, part of what we're doing with the Alumni Association is we have thousands of graduates every year, and we're trying to get people to sort of come back and sort of relive the experiences here because everyone has such a successful background, and also everyone has sort of a side hobby or something else that they're doing that also is just indicative of the journey here. Everyone seems to feel that they wouldn't have had that sort of formation without Nassau, which I think is interesting. How do you feel about that?
That's definitely correct. I mean, I think that Nassau has changed a lot of people's lives, and I think for the better.
Yeah, I think so too. And I feel that every time I speak to an alum, everyone sort of says the same thing. And there's that connection that we all have. We just had a gala with the alumni. People were honored at that, and you could feel that vibe in the room, which was really interesting as well. Going back to some of your hobbies now, you like ping pong and chess. Can you tell us a little bit about that?
Well, ping pong is actually my favorite sport, if you can call it a sport. It's similar to pickleball and similar to tennis, but I've played ping pong since I was little.
Yeah.
And young. And I mean, a lot of musicians play ping pong. I don't know why. Maybe it's for the hand-eye coordination.
It could be that.
And we also played ping pong during medical school in between classes. So it was really fun.
Yeah. It's funny because my husband's a musician. He loves ping pong. My son is a musician. He loves ping pong. I am a musician. We play ping pong. We always had a table when we were younger in the house. It was the green fold-out table, and we used to play. And I remember my uncle always had a pool table set up, and he always had a ping pong table set up. So it's definitely a way to get the stress out as well. And so now moving into I guess the next part of your career. I mean, we never stopped taking classes, but you were saying you were interested in cooking. What other things would you be interested in?
Oh, I mean, I would be interested in taking classes again at Nassau Community College because I had such a wonderful year that I was here. Well, it was over a year that I was here. And I mean, I see that they have a new culinary school coming up, so I might want to take some classes in that and become a chef. I don't know.
Yeah.
Because I love to eat.
Yeah, and it's funny because every time I get the adult ed handbook, which we were talking about earlier, there was a certified mental health first aid, which was like just a few hour course, but I was able to do that, and then taking guitar lessons or whatever it is. But there's so many things to offer as well. And I love the fact that although, people think, well, you're a medical doctor, so you're probably done with school, but that's not really true because you are interested in that.
We are never done with school.
No.
What we have to do is we also have to do education every year.
Yes.
We have to do education, continuing medical education. But I wouldn't mind coming back and taking some courses at Nassau, maybe finishing another degree.
Yeah, that's so interesting to hear you say that because I believe in that too. Although, I completed a doctorate, I still have other interests, and I really like having to learn more because I think there's just so much more that we can learn as well. Do you find that what is your another interest besides cooking? If it was more academic, what would you go for?
I do love tutor. I was a tutor when I also was at Nassau,
okay,
and helping other students really was really nice.
Yeah, I think
it was rewarding.
That's very fulfilling when you can help someone. What would you tell an aspiring student who's ready to come out of the high school right now and they're coming to Nassau for the fall of 2023? What would you say to them?
I've already told students in the high schools that are graduating, kids, friends of the family or anything like that, to go to Nassau.
Yeah.
Because not only is it an affordable way to get your first year or 2 years, or in my case, I got another degree, but it's also a very good education, which you can use to prepare for upper-level courses and at university. And you'll have those credits that you can transfer to another university for really dirt cheap. Not dirt cheap, but I mean, it's really cheap. It's
it's inexpensive.
Yes. And the classes are small, and there's a lot of benefits to coming here.
Yeah, I think so too. I really do. I feel that anybody who's unsure could just try it out. We've had students where the parent might say, well, just try it out for one semester and see how it goes. And then they end up really staying here and having a lot of success here, which I think is really amazing. I would like to thank our guest, Dr. Robert Peck, class of 2008. How can our listeners contact you?
Well, you can either go to my website, which is at www.longislandfootcenters, CENTERS, that's with an S.com. Or you can give me a call from that website or email me or whatever way you want to contact me. I'd be glad to help anybody who's seeking a career in medicine, in nursing, any health specialty, or anybody who's just interested in talking.
Yes. Thank you for being here today, Dr. Peck. I would like to thank you for being our guest. My name is Dr. Lynnda Nadien, and I serve as a director on the board of the Nassau Community College Alumni Association, and I am a proud alum. Lion Tales is available as a podcast on iTunes, Android Podcasts, and Spreaker. More information is online at nccradio.org. Thanks for listening to Lion Tales on the voice of Nassau Community College, 90.3 WHPC.